At this point, we're moving on to the question and answer segment of our session. And I'd like to remind our audience today that they may send in their questions through the Q&A tab in our AirMeet platform. But you can actually also raise your hand. Just click in the raise hands function so that if you want to speak and be part of the actual session, then you may do so. So let me begin by reading the first set of questions. So we have a question from Matt and also a colleague from the Indonesian Harm Reduction Society. The question pertains to, can you describe the role played by people who use drugs and drug user organizations in Malaysia? And a similar question is, are there any Malaysia Harm Reduction CSO network in Malaysia? Take it away, Dr.
Yeah, thank you. So when we set up the first pilot sites for the needle syringe program, they were at 3 organizations: at Ikhlas in Chowkit, where there's a lot of people who use drugs in that community, another one called Intan Life Zone in Johor Bahru, and another one in Penang. In all of those centers, and I have to really give a shout out to my colleague Palani Narayanan, who is now at the Global Fund in Geneva, who really helped me and other colleagues put this together. As you said, Dr. Elma, I was at that time, I was purely a doctor and I had no idea how to set up a needle syringe program. And I called Palani, who did have a pilot project years ago, but was living in Sydney at the time. It's like, Palani, come back and help me. And also colleagues in Australia also helped tremendously in setting up. But yes, we made a point to have either ex-users or users be part of the outreach team in all of these 3 sites. And that continued to be kind of the ethos of the program. Unfortunately, there are, I should delete the word unfortunately, there are organizations of people who either have used drugs or currently use drugs, but many of them are more inclined towards abstinence. At one point, there was an alliance of these organizations, but they're not as strong as they could be. But the Malaysian AIDS Council oversees, the partner organizations involved, at least in these programs that are funded by the Ministry of Health or the Global Fund.
Those are very interesting aspects of the advocacy, Dr. Adeeba. Actually, Dr. Elmer and I were also trying to see the role of the academe in terms of pushing for more harm reduction and public health approach. Would you describe that the academia also played a significant role in Malaysia, at least for pushing for these reforms?
Yes, I think so, because at one point when we started, when there was hardly any local data, and I was going around saying, look what's happened to Australia. They have hardly any HIV because harm reduction was introduced very early. And the example from Scotland, the very, very old examples of reversal of the HIV epidemics. This is what we need to do here. And one of the common criticisms that we used to get in those days but that's Western countries. We're different, we're culturally different. We our people are different. You can't show us that it will work here, was a common criticism. So it's very, very, I think academia is very important. And also when we introduced the program, it was with a lot of opposition, but fortunately, because the government had given it the green light, but we made sure that, particularly for the needle syringe program, that we had a very good M&E in place. And again, I turn to my colleagues at the Burnett Institute to make sure that we could account for almost every needle that went in and almost every needle that was returned. And at the end of the pilot program, we could account for, not obviously not every single needle, but we could show, how many people attended the pilot sites, how many needles were given out, were distributed, and how many needles were returned. And I think that is super, super important in terms of, it was also important for the Ministry of Health that, we were doing this in a very structured manner, and because the concern was that people were just going to flush the needles out in the open and all of that. Yeah, so that role of academia is very important and remains important, as I shared with you the two very important studies, the return of investment study as well as the return on investment, I think, help cement harm reduction and continued funding. Unfortunately, the one showing community-based treatment works better to prevent relapse than mandatory treatment has not received as much traction.
Mm-hmm.
But then again, these things take time, right?
Yeah. Dr. Adeeba, you mentioned that there were issues related to cultural reasons, like how the community in Malaysia would see harm reduction more as a progressive, as a Western ideal, as opposed to one that is consistent with Asian culture. And actually, in the Philippines, the communities do resonate with some of the criticisms, such as the concern on morality, concern on religion, concern on culture. And there's a question on how you were able to navigate more on the conservative culture and religion in Malaysia. And I guess that also feeds on how the community here in the Philippines can navigate around those moral arguments against harm reduction.
Yeah. Dr. Lee, is super important question. We were fortunate in that we had some allies who believed in us, who could see, the need for this and that it makes sense. Obviously, one criticism is that the age-old. We're only going to encourage them to use drugs, right? No matter what studies you show that this is not the case, this is what people believe in. But secondly, in terms of the cultural and religious view that we are condoning this, as I said, we had two really valuable champions, if I must say. One is a religious scholar who then went to the text and looked at the principles of the Maqasid Sharia, the Muslim, guiding principles, and he said, but preserving life is one of the key principles of the Maqasid Sharia, and we kind of use that, preserving lives, preserving the next generation, preserving dignity, etc., etc. So that was a really powerful entry into the Muslim religious scholars, and with that, we then had dialogues with religious leaders, both at the state level, because religion is a state thing. And I recall it was probably the most frightening presentation I had to do, was to talk about harm reduction to the muftis of all the 11 or whatever states that I had to talk to, more so than giving a plenary at an AIDS conference. But gradually, not everybody bought in, and certainly with methadone, they were much more receptive, because it's medicalized, if you like. But with needle exchange, to this day, there's opposition to it, but we managed to just ignore it and continue. And for that, we had to work, of course, with the police, because the police and so again we found a wonderful champion in someone who was I think he was the Deputy Inspector General of Police in his younger days, and he was also the Director General of Prison, and he believed in this, and he went on to become a president of Malaysian AIDS Council, Tan Sri Zaman Khan, and of course, that opened doors with the police department as well, and Ministry of resulting in the Ministry of Health having a memorandum of understanding with the police that we had those who were in the needle syringe program in the early days carry a card to say that they're in the needle syringe program, and so they wouldn't get arrested. It worked most of the time, but when it didn't, then we had to go to police station and things like that and bail them out. Yeah. So finding champions is really, really essential outside the health sort of sector.
That will be a very useful tip for us, because in the Philippines, like religion, even if we do have clear state and church separation, but religion really influences a lot of the perspectives and policies. So, champion.
Understand.
Dr. Adeeba, we have another question here from Patrick of University of the Philippines. How did you navigate the resistance of the government to harm reduction? Any tips? I guess this also goes into maybe an understanding first of what were the common points raised by the government, maybe from the legislative or even from the Ministry of Health or even from our main government partners. What were their main objections to harm reductions? And how did you navigate that resistance from the government in particular?
Yeah, so I guess when in the early phases, when we were knocking on doors and starting with the National Drugs Agency, and they kind of like, this is not going to work. It's Malaysia, what works, like I said before, what works in the West is not necessarily going to work here. And then when we went to the police, same thing. And, the laws are such that, how can we do this? Ministry of Health, there was also some reluctance. And I guess when we saw this happening, the only way we thought to do this was to go to the very top. And that was what we did. We went to see the Prime Minister, and he then led us to the Deputy Prime Minister, who was in charge of, there is a cabinet committee on drugs, and we somehow managed to convince him. And like I said, it was also around that time that Malaysia had to report on the MDGs, and reversing HIV and TB were the goals that were not achieved. So we came at the right time, I suppose. And so once you get the green light from the top and the cabinet, or at least from the Deputy Prime Minister downwards, the other ministries just had to comply. But we started off as a pilot. We promised them that we will do it as a pilot. The needle exchange was done, quietly in a way. And so when we achieved the milestone at the end of the year, I think so long ago I can't remember, and showed to them that look, the sky didn't fall down, and asked for an expansion. It happened. Yeah. But there was also a lot of training to religious leaders, a lot of training to Ministry of Health personnel as well, because the methadone treatment, it was relatively new, and so Ministry of Health undertook training of those who are going to prescribe methadone, training to prisons department and things like that.
Speaking of knocking on doors, I have a question. So I think the experience in Malaysia, because we're in the same part of the world, is more legitimate. We the other countries in the region can draw some credibility and legitimacy by citing the Malaysia case. right? But of
Mhm.
course, it's awkward for Malaysia to assert the Malaysian model in other
Sure.
countries. But how might the countries in this region um, work with each other so that we can stand on your shoulders, so to speak? You've been at this for 20 years now. With our country, the Philippines, is just starting. And imagine other countries, Cambodia, Laos, Myanmar, might also draw strength from your stories. Do you have any thoughts on what regional collaboration might look like? If it,
Mm, mm.
yeah, besides this once a year conferences by video, do you
Yeah,
have
I
any
hear
thoughts?
you. I hear you. Yeah, I think, I'd like to say ASEAN, but nah. ASEAN has a abstinence, zero tolerance to drugs, and there are a few countries who shall remain nameless who are staunch, abstinence supporters. And ASEAN works in a really weird way. So even though Malaysia should be using its success, right, and show how we've managed to turn the tide on HIV through harm reduction, I don't know what happens at ASEAN meetings, but when they go to ASEAN meetings, suddenly everyone signs on and say, yeah, we must fight drugs and we must be tough on drugs. So they just melt and they just go on this herd mentality, and everyone just goes back to the same zero tolerance. So forget ASEAN. In summary, so the other avenue might be through UNODC and UNAIDS, and I think that is maybe one area that we should look at and work harder to get their help, because particularly with UNODC, because I think the criminal justice system still take some guidance from UNODC. And so if UNODC, at least the HIV arm of UNODC, provides a platform for this regional network, I think that would also lend a lot of credibility with organizations like the police and drugs agencies.
Thank you, Dr. Adeeba.
But like you said, it has to be a sustained, almost like programmatic, rather than this, annual meetings or having me come to Manila and talk, and then it needs to be much more structured, I guess. Mhm.
Dr. Adeeba, actually, in the audience right now, we have representatives from the criminal justice sector. So we have judges, we have police members, uh,
Wonderful.
yeah, and we have individuals working under a criminal and law enforcement model. So I understand that the model that we are discussing right now, harm reduction, does not look at abstinence or does not look at drug use as a criminal issue, but more of as a public health issue. Can I ask you to talk more about this shift in perspective, um, considering people as criminals, quote unquote, or considering persons who use drugs as persons and addressing the health consequences of drug-related issues? What would you say would be the difference in this perspectives, and what would you say would be an important step for us to shift towards one that embraces the public health approach?
Yeah, thank you, Dr. Lee. I think through the years, what I realize is that there is a lot of there is a lack of understanding, first of all, at what drives people to use drugs. The social environment, and that it's complex, that it's not just moral weakness. So I think we can't stress enough that anyone is at risk of drug use, given a few risk factors like a terrible home circumstance, or poverty and all these things. So I think we as academics and people who work in drug use don't share these findings enough with the public. Remember, for 4 decades now, the public's just used to, people who use drugs, they're evil people, they're useless people. Let's just lock them up, and not think about them anymore. And so I think that's a missing piece. And then, of course, the impact of the different drugs and what it does biologically in terms of the whole addiction process is also something that we don't articulate very well to the public and to our stakeholders. That once again, it's not a simple a simple thing once you're hooked on drugs to stay away from it. And there's that whole biological process that need to be treated, just like people with diabetes, etc. So I think those 2 elements in a way are missing, and all these years the public and others have just had this perception that people who use drugs because they're bad and they deserve to be punished. So we need to be much more vocal and systematic in terms of giving that other perspective of drug use, that look, anyone could be at risk given enough factors in our lives to make us susceptible to drugs. And once we start using, coming off it is also not a simple matter.
Thank you, Dr. Adeeba. We have an interest from our participant, a judge, no less, a regional trial court judge, to join in our discussion. She's raising her hand. May I request our host to bring in Judge Corazon in the speaker, please? Judge, thank you for joining us today. The floor is yours for comments or questions.
Thank you so much. I was very impressed with the presentation of Dr. Adeeba. I couldn't wait. I have a session actually on Friday, but I couldn't wait but to give in some comments in relation to the presentation of Dr. Adeeba. Because at the back of our minds, the Filipinos right now are all asking, how do we learn? How do we, make use of the learnings from other countries like Vietnam and Malaysia to our Philippine experience? I was thinking, what impressed me so much in the presentation of Dr. Adeeba is the way she presents things in terms of data. It's like, if we want to convince people, we have to have evidence-based solutions. Right now, for example, in the Philippines, we have had at least 2.5 years experience of plea bargaining, whereby we have allowed people to undergo drug dependency examinations, and we have the DOH, the Department of Health, have helped us a lot in terms of determining what kinds of intervention they need. Can we have perhaps a research on, for example, to closely examine how many of the drug offenders that have gone under plea bargaining are actually drug dependents? How many of them needed residential inpatient treatment? How many of them were recommended for intensive outpatient? How many of them were recommended for community-based rehabilitation? And how many of them have actually no drug dependency, problem? So this data, I think, would be convincing enough for us to convince our policymakers that, we have to have evidence-based solutions and not just, following the law as it is right now. Our RA 9165, which is the law governing everything about drugs, was in 2002. Has there been a comprehensive review about the effect of RA 9165 in terms of, achieving the results that it wanted to do at the time in 2002? Has there been a review of the effect of RA 9165 in terms of, reducing the pernicious effect of drugs? So I think from us practitioners, it is time for us, as Dr. Adeeba was suggesting, to reveal our findings based on our experience. So I hope that maybe some academic institutions or CSO can, pursue this, finding the trends, finding conclusions from the data that we have. Thank you very much.
Thank you, Judge. I couldn't agree with you more, actually. In fact, in Malaysia, there's still confusion over the difference between, recreational use, occasional use, addiction. One of the problems we have is, people can just be sent to prison just by having a positive urine test, and so from
Same thing.
obviously from a clinical perspective, you don't diagnose addiction from a urine test. So these are some of the laws that really need to go, and even, we haven't done those sorts of legal studies as well, and I think we also should do the same, Judge. Thank you for that.
Thank you.
Thank you, Judge Corazon, Dr. Adeeba. That's a very inspiring exchange. Actually, these types of conversations open us to like the possibility of transplanting like the best practices that we can see that is applicable in the Philippine context. And I just realized that we've already gone 10 minutes beyond our original schedule. Dr. Adeeba, do you have some final words that you'd like to share to the audience today? The audience today is primarily from the communities, actually. These are individuals who are providing services for people who use drugs. There are also representatives from treatment centers, quote unquote, rehabilitation centers for catering to people who use drugs. And you've heard representatives from the government as well. What would be your message to this core group in relation to the harm reduction advocacy?
Yeah, so I think in solidarity, I know that the work that you all are doing and the work that we all are doing is difficult, and it's taken us in Malaysia more than 10 years to see the benefit, and through that, there have been so many ups and downs, and I can tell you the number of times that individuals want to give up and such like. So take heart in knowing that the work that you're doing is very, very important, and the path is not easy, but as hopefully we've shown, it's the outcome is tremendous. So keep doing the good work, and hopefully we will also be able to share the joys of seeing changes in the Philippines in a few years.
Thank you very much, Dr. Adeeba. We're looking forward to maybe the 20 years experience that we have from Malaysia. We don't have to undergo 20 years also. We can hasten the whole process, knowing that we have you and all other kind-hearted experts and individuals helping us move forward, especially at this very crucial time in the Philippines where there's focus on drug-related issues.